While parents of young children might be concerned about the new coronavirus, confirmed cases among children remain low around the world. A similar pattern was seen in SARS, where the rate of reported infection in children under 14 years of age was much lower than in the older age groups. Dr Asha Bowen is a paediatric infectious diseases specialist at Perth Children's Hospital and infectious diseases researcher at Telethon Kids Institute. And she joins me now from Perth. Dr Bowen, it was again reiterated by the Health Minister and Chief Medical Officer today that children are largely not contracting coronavirus and those who are getting a mild dose. What do we know about the numbers?
Well, so far we know that of the almost 90,000 cases that have been reported globally, only a small proportion have been in children. And in those cases that have been reported in the medical literature, there have been no fatalities in children. So children tend to have had a relatively mild experience with coronavirus when they have been infected.
And what about here in Australia and children being affected by it here?
Well, so far there has been only the one case of coronavirus in a child here in Australia, and that is someone who was part of a tour group returning from Wuhan. So we haven't had any local transmission of the coronavirus in children that I'm aware of.
So how is this being explained? Are the children not getting it at all, or is it so mild that they're not being tested for coronavirus? And of course I'm speaking largely overseas, as the numbers here are a bit lower.
Yeah, definitely. I don't think we have a full explanation for it as yet. It's likely that it's a combination of all of those factors, that children may not have as severe symptoms and so therefore are not being tested. They may well have just a milder experience of it because they don't have some of the comorbidities that are being reported in the older age groups that make adults at higher risk of getting sick from coronavirus.
So is this surprising at all to you that children are being largely unaffected by it?
It's always a surprise as a paediatrician, and particularly if we contrast it with some of the other respiratory viruses. But there are examples of infections that have a milder, disease in childhood than they do in adults. An example of something like that might be chickenpox, where a lot of kids get chickenpox, but they don't get as nearly unwell with it as, say, adults do when they experience that particular virus.
And so the fact that children either aren't getting it or are getting relatively mild symptoms, that's obviously a good thing for the children and also their parents. But is it also a bad thing in terms of the fact that they can pass it on unknowingly?
Well, I guess that's our fear and our concern, is that they may well be a big transmission factor in our community. And we see this with other respiratory viruses where children are able to, spread, say, for example, influenza through the community during the winter months. And so things such as the influenza virus vaccine are quite helpful in controlling that transmission. Studies that have been done in the UK have shown that. And so we do think it's really important for parents to be aware of the coronavirus and be aware of really simple strategies that they can take to help both protect their children and their families from getting sick.
Well, you brought up vaccines there, and of course a vaccine for the coronavirus is a fair way off, but do you think there's more incentive now for parents to get a flu shot for their children this coming flu season, or do you think it's just exactly the same as any other flu season?
Oh, I think as a parent, I'm very committed to the influenza vaccine, and I particularly think it's important this season because we've got a new virus circulating. We really do want to make sure that we do the best to protect our children from respiratory illnesses, and also, avoid that confusion between could this be corona or could this be influenza. And so doing what we can to prevent influenza is a really important strategy, and we do have a vaccine for that particular virus, and I think we should be using it as best we can.
Dr Asha Bowen from the Perth Children's Hospital and Telethon Kids Institute, thanks for joining us.
Thank you.